Hello everyone. In this video we will discuss about oculomotor nerve. Under this topic we'll discuss the nerve's origin, course, structures supplied and the clinical correlation. Oculomotor nerve is the third cranial nerve. It is a somatic motor nerve. The parasympathetic nervous system fibers also runs along with it. Origin. The somatimotor fibers emerges from nucleus of third cranial nerve, which is located in the midbrain, at the level of superior colliculus. The parasympathetic nervous system fibers arises from the Edinger-Westphal nucleus, located lateral to the nucleus of third cranial nerve. Let's move on to the course of the nerve. This diagram is a closer view of cross-section of brain. We have superior colliculus and inferior colliculus marked in the figure. The nucleus of third cranial nerve lies at the level of superior colliculus and is marked as a yellow dot. The blue dot marked below it represents Edinger-Westphal nucleus.
The somatimotor fibers emerges from the nucleus and passes between the posterior cerebral artery and superior cerebellar artery. Posterior cerebral artery is marked as PCA and that of superior cerebellar artery as SCA.
The parasympathetic fibers also moves along with the nerve and forms a part of the oculomotor nerve complex. The blue tube shown in the figure represents cavernous sinus. The cavernous sinus is situated in the middle cranial fossa. The oculomotor nerve, after passing in between the two arteries, enters the cavernous sinus and continues its path along the lateral wall of sinus. The parasympathetic fibers follows the somatic nerve and moves along the lateral wall of cavernous sinus. The orange-colored structure shown in the figure represents superior orbital fissure. The oculomotor nerve, after coming out of the cavernous sinus, exit out of the skull through this fissure. The parasympathetic nervous system fibers also exits the skull through the same fissure. After exiting out through the superior orbital fissure, both oculomotor nerve and parasympathetic fibers enters the orbital cavity. Within the orbit, the somatimotor fibers gives off two branches, a superior branch and an inferior branch. The parasympathetic fibers follow the inferior branch of the nerve and go to a ganglia called the ciliary ganglia. The postganglionic fibers form short ciliary nerve, and they gonna supply the sphincter pupillae and cillaris muscle. Now let's discuss about the structures supplied by the third cranial nerve. The figure shows the posterior wall of orbital cavity. In this figure, light blue ring denotes superior orbital fissure, and the dark blue ring represents the annulus of Zinn, which is also called the common tendinous ring. The portion of the superior orbital fissure within the annulus of Zinn has the superior and inferior branches of oculomotor nerve. Both branches supply extraocular muscles. The superior branch supplies the levator palpebrae superioris muscle and the superior rectus muscle. The inferior branch of the third cranial nerve, like superior branch, supplies another three extraocular muscles. Those muscles supplied are inferior rectus, medial rectus, and inferior oblique. Let's look onto an easy way to remember which nerve supplies which muscle. Here is a mnemonic. SO4, LR6, ATR3. That means the superior oblique muscle is supplied by fourth cranial nerve and that of lateral rectus by sixth cranial nerve. And all the rest supplied by third cranial nerve, that is the oculomotor nerve. Next we are gonna highlight the function of various muscles supplied by the nerve. The parasympathetic nervous system fibers supply sphincter pupillae and cillaris muscle. The inferior branch of oculomotor nerve supplies inferior oblique, inferior rectus and medial rectus muscle. Whereas the superior branch supplies levator palpebrae superioris and superior rectus muscle. Now we are going in detail about the function. Both cillaris muscle and sphincter pupillae muscle controls the size of pupil. In case of muscles supplied by the superior branch, the levator palpebrae superioris elevates the eyeball. while the superior rectus elevates the upper eyelid. Moving on to muscles supplied by inferior branch. The inferior oblique muscle helps in the elevation of eyeball and rotates it laterally. The inferior rectus muscle depresses the eyeball and rotates it medially. And the medial rectus muscle helps in the abduction of eyeball and rotates it medially. So guys, we are winding up this session by discussing clinical correlation of the nerve. The complete or total paralysis of the oculomotor nerve causes drooping of the upper eyelid. And eyeball gets turned downwards and laterally, as shown in the figure. Damage to the parasympathetic nervous system fibers causes dilatation of the pupil and pupil becomes fixed to light. A midbrain lesion causing contralateral hemiplegia and ipsilateral paralysis of third nerve is known as Weber's syndrome. Another syndrome associated with third nerve is the Benedict's syndrome, which is characterized by ipsilateral third nerve palsy, contralateral distal limb weakness and loss of sensation. This was a small description about oculomotor nerve. Hope you all guys got some idea about it. Thank you for watching our video.